Thank you for joining us here for Healthline 3. I'm Jessica Crandall. Today we are tackling the topic of allergies and hay fever with Dr. Chris Wolcott with Urgent Care, and he'll be answering all your questions for the next half hour. We want to encourage you to ask exactly what's on your mind when it comes to allergies. If you're online, just click on the orange Healthline 3 box. It's halfway down the right side of your screen, and type in your question and submit it, or you can just give us a call, and the number to dial is 318-219-4569. We'll be taking all your questions until 12:30, and we want to ask Dr. Wolcott, when is allergy season? Is it right now?
It is. We're in the very beginning of it.
Okay.
As soon as the weather starts to warm up, the trees start to react.
And is it just during spring? Is there more than one allergy season during the year?
There are several different plants will bloom or pollinate during different times of year. Another great one that is surprises people is in September, October time, and that's a lot of the different grasses will release their pollen, and so there are several throughout the year.
And so right now, what is in the air?
Oh, we're about to be hit hard by the pine and oak trees. All of our big popular trees in this area. Most of your larger trees, and then of course all of our flowering plants are going to start releasing their pollen. I think probably the most beautiful and famous around this area will be the azaleas.
Awesome. It's the prettiest time of year, but also the worst for allergies, it seems. So let's talk a little bit about hay fever and allergies. We hear those terms a lot, but is there a difference between the two? Are they one and the same?
They're basically the same. Allergic rhinitis, which is the scientific term for inflammation in the nose due to allergies and seasonal allergies, and hay fever, just a generic term that we use to kind of an all-encompassing term for this type of syndrome.
Okay, and I was speaking with our anchor, Jerry May, who does the 6 o'clock news with me, and he said that he actually got allergies later in life when he didn't have them as a child. Does that happen a lot where people kind of acquire it as an adult? I've
actually experienced the same thing in my early 30s. I started to develop seasonal allergies, and then some people will do just the opposite, have bad allergies throughout their life, and as they get older, they stop having the reactions, and but it is very common for people to develop them later in life. Okay, so you need to watch out for those symptoms, see if you have them. What do people need to check out for if they do have allergies? How will you know? The most common is going to be when you are exposed to an allergen, and in this time of year, the allergens are going to be outside. So if you experience itchy eyes, watery eyes, runny nose, sneezing, scratchy throat when you walk outside and exposed to the pollen, then you probably have allergies. Okay, now we've got a caller on the line for you, Dr. Wolcott. Wayne is on the phone with us. Wayne, how can we help you today?
Okay, I have previously, before, tried to check into this and see if I could get some kind of a cure, because I'm trying to treat this myself and not having much luck with that or success with that. And it is that I have found black mold infestation in my apartment, and I've since gotten rid of it some long time ago, but I'm still receiving the effects of the stale air, etc., even though I take loratadine as an allergy cure, I guess, or medication. And also I have, over-the-counter cough drops or whatever, Ricola specifically, herbal. And I just haven't gotten much a response, relief, that's what I'm saying, from this infestation that's still evidently floating around. The spores are evidently floating around in my apartment here, and it's causing me a lot of problems at night.
Okay. Well, there are a lot of options, Wayne, and thank you for the question. The loratadine, or the over-the-counter antihistamines, are good. Certainly, it's not the only medication out there. I think the first step I would do is confirm that the black mold is out of your house. The people who suffer from allergies are going to be susceptible, or I'm sorry, people who suffer from black mold allergies certainly will be susceptible to the symptoms they bring. And if you are continually being exposed to it, whether it is in the walls, in the ceiling, or in your air conditioning vents, that would have to be completely removed, and that requires a professional intervention. Because we can put you on a lot of different medications and control the symptoms, but the goal,
Right.
the number one goal of allergy suppression is to get away from what causes the allergies. You can actually go even further into testing, whether it be skin testing or blood testing, to see exactly what you are allergic to confirm that you are allergic to the black mold, or maybe to some of the other grasses, trees, pollens, insect allergens, pet dander, and so forth. We can check all those things on what's common in this region of the country, and then they can tailor. If the allergies are hampering your life so much, you can actually get on allergy suppression, the so-called allergy shots, where it can actually reduce your reaction to the allergens. And for some people, they become they can become no longer allergic to those allergens. Beyond that, there are what we call second-line medications that are beyond the antihistamines. There's another chemical that's involved in the allergic reaction, and not important that you remember the name, but they're actually called leukotrienes, and they come from another cell. And there are medications that you might have heard of called Singulair, and it's called a second-line medication, and it's just another way to attack the allergic reaction and prevent it from happening. But I think if you were having a black mold reaction, you have to confirm that it's out of your house. Otherwise, your reaction will continue regardless of what kind of therapy that is instituted.
That's right. As a matter of fact, I noticed a difference between, say, be gone for a while from my apartment, and I don't seem to have the coughing spells that I do when I'm in my apartment. So it's evidently still in here somewhere. And I didn't, I got rid of the sores, what I thought was the sores, but then no telling where those spores have landed. See?
Yes, sir.
And they're also interrupted by heating and also by air circulation.
Yes, sir. And you bring up a very good point. And it's your point is the opposite of somebody who's allergic to pollen. A person who's allergic to pollen walks outside, their symptoms start. You are allergic to something in your apartment, so when you walk home and into that environment, your symptoms start. And so, yes, I would have a professional come out and evaluate your. Did you say you lived in an apartment?
Yes.
Because I would be curious to know is if your apartment was cleaned and had it taken care of there, or one of the adjoining units having an issue.
Oh, no, I don't think it's from any other apartment, because, like I say, I found the infestation here.
Yes, sir.
In that apartment, and it was just from a faulty, a leaking window here in the front, and I had some boxes packed in the corner, and whenever it rained from the north, I got this rain to come in under the sill, and eventually, get the boxes soaked and moldy and et cetera, et cetera.
Yes,
and,
sir.
It just was there for a while and turned into the black mold, you see.
Yes, sir.
So
that's one of the most common ways.
And I've also had the management, or the maintenance, I should say, recaulk that window, so that I won't have that evident problem again.
Yes, sir. Did a professional company come out and clean out the mold and then do air quality testing?
No, it wasn't anything like that.
Okay.
It was just a regular maintenance man around here.
I would be worried that you're still having exposure to the black mold or some other allergen in the building and in your apartment, because professional air quality testing does just that. They take samples of the air and they can tell you how much of the mold is in the air. And if it's over certain thresholds, then they know that there's still a source of mold in your house, and they can remove it.
Well, I don't know if landlord would pay for this. See, that's the thing. So
I would check into your renter's rights.
I'll bring it forward. I'll bring it forward to them, and et cetera, and see, whether or not they'd be willing to do that.
Yes, sir.
But I just don't. I've got offhand. I don't think they would. It's probably going to be my expense, and I really can't afford it.
Yes, sir. Well, you might have something in your contract or your lease that, and I believe there might be some responsibilities that fall on the landlord, but that would be up to your individual lease and
I would
contract.
think for the health of the accompaniments, the tenants here, I would think so.
Yes, sir.
I would think that would be something they would be concerned about, so they wouldn't get a lawsuit that's coming up or what.
Okay.
Something like that. So I will bring it forward to them. Thanks for mentioning that. I never even thought about that angle.
Yes, sir. Well, you're very welcome.
And as far as what I've tried to do is I've been up to the VA. Okay, I'm a veteran.
Yes, sir.
I've been up to the VA here in Shreveport, and they told me that they could not test for black mold.
Well, there is
There was a chest X-ray, and they turned me down on that.
Yes, sir.
That I had to go through my primary care provider and had to set up appointments, this and that. And I went to emergency because what had happened was the day before I had a serious earache and some drainage out of my left ear. Well, when I went to get it checked out, I went to the emergency room and they told me that I had an ear infection. Okay. Well, so I went online and looked all this up and did my research on it and whatnot, and I noticed that an ear infection can be caused by black mold infestation.
Okay.
So I thought I had it real bad, and that's the reason I wanted a chest X-ray, but they turned it down.
Okay.
Well, Wayne, hopefully the doctor was able to answer your question today. We appreciate you calling in.
Okay, I'm sorry I took so much time.
Oh, no, we appreciated your question, and we hope you have a great day. We got a couple other callers I think we need to get to. So I believe we have Lynn on the line next. Lynn, are you still there?
Hello.
Hi, Lynn. What's your question for the doc?
Okay, am I on the phone with him now?
Yes, ma'am. I'm right here.
Okay, then. And sir, I'm sorry, I didn't get your last name, doctor. What is it?
Wolcott.
Wolcott. Okay, thank you so much.
Yes, ma'am.
I remember about 4 weeks ago, I was outside coming into my apartment, and I felt something, but it wasn't crawling, but it went up a left nostril. And the further it went, as it progressed, it got colder and colder, the nostril did. And it finally went to the back. Within about a week or 2 weeks, the nasal sinuses start producing thick mucus that was yellow and brown, about the consistency somewhere between glue and Jell-O pudding.
Yes, ma'am. You said you felt something go up your nostril?
Really, what I felt was that something was going up the nostril. Okay. I didn't feel it crawling, but the further it went up, it got colder and colder. It's like you could tell a progression what's going on.
Well, certainly if an insect happened up your nose, any type of foreign material or foreign body is a nidus or a trigger for a pretty good infection.
Yes,
that can
I think
occur.
It's a pretty good one because it's still yellow and brown.
Yes, ma'am. And now, if it was a little bug, then they can get in there pretty deeply, and then if it's causing a lot of discomfort, there's a chance we can get it removed and relieve
at times
any.
I can't breathe. I didn't feel it crawl though.
Yes, ma'am. And then sometimes it's just an allergy or a sinus infection can feel like that, as well as the tissues in this area of the nasal cavity and sinuses start to swell. You will feel that discomfort, and it blocks the flow of the normal fluids that are produced in the sinus cavities, and as they build up, they can become infected as well. And if you are draining out what we call purulent material, or frankly pus, that's a sign of infection. The classic example is a child comes in and has very nasty drainage coming from their nose, and our first thought is, what did this child stick up their nose? Because it blocks the flow. And so a bug can do that, or any type of material that blocks the nasal passage can become a place for infection, and would need to be evaluated to see if it can be removed or the infection treated. And if it was a bug, not to be gross, but a bug will decompose and your body will take care of it. Something like a Mardi Gras bead, which is very common for children to stick up to stick up their nose, those will not go away and would have to be removed.
This has been going on for about 4 weeks, and
yes, ma'am.
Even last night I just had to blow and blow and blow. Like I say, it's so thick. It doesn't run out. It is thick and they're like glue.
Well, 4 weeks is a long time. That is probably something that needs to be evaluated, and quite possibly need some antibiotics and some other medications to help open up the sinus and nasal passages to get it flowing back to normal.
Okay, Dean. Okay.
All right.
I thank you so much.
Thank you, ma'am.
Hopefully I'll see a specialist very soon, and it's okay to ask them to take a sample, is it not?
Yes, ma'am. If one's needed, they can take a sample of the fluid and see if it's infectious. Sometimes you can just tell by looking at it, the color, the consistency, and any odor to it. You can tell.
I don't want to carry them a sample. You know, I'd rather they just try to get one.
Yes, ma'am.
Right.
Well, thank you so much.
Thank you, ma'am.
Absolutely.
Okay, you have a good day now.
You too. Thank
Thanks,
you.
Lynn. We hope you feel better soon and get that resolved. That sounds like not a good problem to be dealing with for 4 weeks.
Not at all.
Well, I believe we have another caller on the line. May, are you there?
Yes, I'm here.
Hi, May. How can we help you today?
Yes, I wanted to ask the doctor. I have like thick drainage draining down my throat, and I was told it was a sinus infection. And so whenever I take antibiotics, it goes away. But when I smell candles and air fresheners and stuff, it comes back.
It sounds like you have a sensitivity to perfumes or heavily scented oils, and what will happen is you will, when you breathe this in, the linings of your nasal passage or your sinuses are becoming inflamed, and they will swell up and they will leak fluid, whether it just your plain mucus. But when you're swollen up, the natural flow of the fluids in the sinuses and the nasal passages can be hindered. And when they're hindered or they start to back up, they become a nice place for infection to grow. And so again, with allergens or irritants, the best treatment is to avoid heavy perfumes or scented candles or anything that triggers this. It would be to avoid them. If you are going to run into them from time to time, then you might want to try an antihistamine such as Allegra, Claritin, Zyrtec, or Benadryl to prevent the reaction that you would have when you were exposed to these irritants.
Okay, then. Thank you.
Yes, ma'am. You're welcome. Thank you.
Thank you, May. And luckily, you can buy a lot of unscented products now, right? Would that help her?
Correct. Absolutely. I personally, I don't do well with heavily scented products either, and so anything that's going to be on the face, lotions or shaving creams, they make unscented for just about all of them.
Is that becoming more common for people to have that issue?
I think there was I don't know if it's becoming more common that there's been a big change in how people are reacting to these. I think people might have always been a certain percentage of people are sensitive to it, and the products are just becoming more of an option these days.
Right.
There's been a big push for unscented and no dyes, and just push for all natural products that have the less chemicals you have in a product, the less chance you have of reacting to it.
Absolutely, that makes sense. Okay, we've got another caller for you, Dr. Wolcott. Betty's on the line with us. Hi, Betty.
Hi.
Hi, Betty.
Betty, what's your question for Dr. Wolcott?
I was calling about I was trying to get about the affordable care, affordable care.
Yes, ma'am.
Affordable care.
The health insurance?
Uh-huh.
Yes, ma'am.
Okay.
Do you have a specific question on it?
Well, really, I really don't understand. I don't know how to go about, trying to sign up for it.
Okay. Well, it's a real complex topic, and believe me, I find it hard to find any one person that understands every aspect of it. But I believe there's the websites that were provided by the federal government, and there are 1-800 numbers that you can call.
Yeah.
And the process for signing up is an online process where you type in your information, and then after a period of time they process it.
That'll be my problem. I don't know. I don't have a computer.
Okay.
And plus, I don't know anything about a computer.
Okay. Well, in fact, I believe there are 1-800 numbers, and I don't know the number right offhand, but helplines that can help you with that. And then I believe there might even be online help. And so one of the places where you could start would be the public library, where you have access to computers. And then I believe the librarians and the staff there could certainly help you as far as working a computer. And then the process, there have been some difficulties at the beginning, but since they've released the Affordable Health Care Act and the sign-up process, they've been streamlining it and trying to make it an easier process. And so I believe they did this with people in mind who might not be comfortable around computers, to make it to where it would be easier to sign up. And so if you started at the library and just got online and had the people at the library help you, then they might be able to uncover the phone number to call in, and sometimes I think they might even be able to sign you up over the phone. I'm not sure.
Right, and those libraries are free. And we also, tonight from 5 to 7, we've got some health navigators coming into KTBS, Betty, and they'll be answering any questions you have about the Affordable Care Act from 5 to 7. So if you catch our shows at 5 and 6 o'clock tonight, you'll see them, and we'll have a number you can call where you can get some answers right then and there, too.
Okay.
Yeah, did you have any other questions?
That's it.
Okay, thank you so much. Have a great day.
Thank you.
Thank you.
All right, Dr. Wolcott. So for anybody who's just tuning into our show, there's a number you can dial. We're talking about allergies right now and hay fever, everything that's in the air this spring season that's irritating us. Get your calls in and any questions, concerns that you have right now, you can ask Dr. Wolcott. He is with Urgent Care of Louisiana, and the number to call is 318-219-4569. You can also go online to ktbs.com, and there's an orange drop box on the right-hand side of the screen. You can fill out and ask your question online as well. So, Dr. Wolcott, let's talk a little bit about some of the treatments for allergies. What would you typically prescribe for someone?
The first line therapy are going to be the medications called antihistamines. The original back in the day was Benadryl. Some people find that that's kind of sedating and makes them tired, but that's over the counter. Then probably in the early 90s, late 80s, the big three, as we like to call them, Claritin, Allegra, and Zyrtec came out.
Right.
They have since been moved to over the counter. They are classically considered the non-sedating antihistamines, and they do a very good job at blocking this reaction. And there are several others that are still prescription that if Claritin, Allegra, Zyrtec do not work, they've manipulated the chemical structures of some other antihistamines, and so there's a prescription alternative as well should the other ones not work. Yeah.
Now, would you recommend someone going to their doctor before they try something like Claritin or Allegra?
No, well, I always encourage people to see their doctors, never tell somebody not to go see, but when a medication is typically moved to over-the-counter, it has been studied, and its safety profile is usually pretty, has been well tested. And so these medications, if you are having symptoms of allergies, the itchy eyes, the scratchy throat, the runny nose when you go outside, and especially this time of year, it's perfectly okay to take the manufacturer's recommendations and take the medication as directed on the box and see how it works. And if it works, great. And if you're not having side effects from it and you're getting the results you want, then certainly that is something that you can try on your own. And it's when it's really recommended to see your doctor is when that line of medication is not working for you and it's just really affecting your life. You don't want to walk outside because you feel so miserable.
Right. And our caller earlier, Wayne, our veteran who dialed in, you had mentioned to him that it's good sometimes to get tested to see exactly what's causing your irritation. When would you recommend that to someone? I
would recommend that when testing is needed when it's affecting your life so much that you can't participate in activities or work or don't want to go outside. Maybe you've tried the first line therapies, the over-the-counter medicines, and been to your doctor and tried the second line or even third line medications or the different medications that are available. Maybe you've had injections or nasal sprays and it's just not working. And the blood testing is, or skin testing, is when we actually test and find out what you're definitely allergic to. And different areas of the country and different areas of the world will have different allergens that you're exposed to. So in this area with the grasses and the pollens and the pine trees and mesquite and oak and unfortunately cockroaches and other allergens that are around us in this region, we can test and find out exactly what you're allergic to. Now, the benefit of that is if you're going to do allergy therapy, which is typically the good old allergy shots where you go once or twice a week and get a shot to what it does is actually exposes you to that allergen in microscopic amounts, a little bit at a time. And eventually, the goal is to have your body accept those allergens as normal. Right now, your body gets exposed to them and it hates them. It sends up a full-blown reaction, a defensive measure to protect your body against these foreign invaders. Unfortunately, the allergic reaction is a little over the top. Your body gets a little out of control defending itself against pollen. And all the chemicals that are released, what we'll do is you try and block those chemicals with medicines. Well, if you can't block those chemicals and you're still miserable from it, what we try and do is trick the body into accepting it as normal. And once your body accepts it as normal, then you no longer react to it. And allergy treatment gives people relief about 80 to 85% of the time, if my numbers are right. So you should see some improvement. Now, some people are on allergy shots for the rest of their lives, and some people get on them for a few years, and then they'll have protection for several years and come off the shots, and then some people will have to get on them again just to have relief. And
I know for some of us, me especially, I get nervous around doctors. I see those white coats and I kind of tense up a little bit. And you talk about testing. Kind of break down for those of us who get nervous about testing what that would entail if they got tested for allergies.
There are two different main types of tests. One is at our clinic, what we do is we can simply draw a vial of blood. So we get a little needle, draw a vial of blood, and we run it on the blood test just like that. There are skin testing. There is skin testing that you can perform, and what they do is they take the allergen and they just make a little indentation on your back. They don't even scratch you anymore with it. They don't break the skin. It's a little soft point that pokes your skin, does not break the skin, and then they measure the reaction. Actually, if you go to the Urgent Care of Louisiana Facebook page, there are pictures of my skin test on my back, and you can see my reaction to all the different allergens. We went through the skin testing, but we have since switched over to blood testing because it's a lot simpler, and we think easier on the patient. There's no itching involved and no reaction. We just test for certain antibodies and antigens, different proteins in your blood, and we can test for each and every allergen.
Okay, that sounds doable. I think even I could do that.
Yep.
Let's talk about sort of the ages where you would get this done. How young would a child be to get them tested for allergies?
It's all based on symptoms. Some of the testing, the treatments, I believe, go down to might get me wrong on this, but I think they can go as young as 2 if it really is involving and interfering in their life. But certainly we like to get to ages where they can understand what we're doing, and somewhere around that 6-8-year-old range. As far as honestly testing, you could do on any age group because all I need is a vial of blood. But we don't get too many young kids in with severe allergies. Usually allergies develop over time, and so the late 8, 9, 10, and then early teen years is when we start seeing it.
Okay, we've got just a few seconds left here, Dr. Wolcott. If anyone wants to get in touch with you, what is the number they should call?
We're at 868-2273, and that's 868-CARE.
Okay, and location?
We're on Fern Avenue near Sports Spectrum.
Okay,